Welcome to this live panel event on how to build a sustainable wellbeing strategy. I'm Harry Bliss, co-founder and CEO of Champion Health, and we want to put this session on for you to be able to really support you if you built a strategy and how to maintain and develop your strategy. Or actually, if you don't know where to start, we'll give you the building blocks and the foundations to be able to know where to start. Now, when it comes to building a wellbeing strategy, this is such an important topic for us. When we look at our businesses, most businesses will have a business strategy, a sales strategy, a marketing strategy, for example. But when we look at wellbeing strategies, it's sometimes an afterthought, and especially until the last 2 years, it's now becoming more commonplace. And I would argue it's just as important, if not more important, than your marketing strategies, sales strategies within there. Because after all, if we don't have our people performing, then there's no point in having those other strategies around us. So we're going to cover everything around how to build a sustainable wellbeing strategy. Now, why is this session important to me? I'm sure all of you, it's crucial to you as well, as you've joined this session. But my personal background is I lost my friend and mentor due to a short bout of workplace stress. This was someone that was a director on the FTSE 100 at the time, someone that invested a huge amount of time into me, someone that set up a local community cricket club and raised over £750,000 for charity. And he had no previous history of poor mental health, and it was a 2-week bout. And so that's the first reason why a wellbeing strategy is important to me. But it's not just that. As a business owner myself, we need to make sure we are supporting our team so they can all thrive inside and outside of the workplace. On one end of the continuum, the supporting people in crisis. On the other end of the continuum, it's how can we support people to thrive if they are already doing so. So in today's session, what we'll be able to cover is everything from making wellbeing inclusive, accessible and engaging, what topics to cover, how to make your wellbeing strategy global if you are so. But really the key thing is we want to answer your questions within here. So if you use the chat feature, you can either type questions to the panelists, or actually you could even converse yourself as the listeners as well. And we'd love it to be engaging. That's really important. There's no point in us putting this session on if it's not going to be tailored to you. We'll also record the session. So if you'd like a recording, we'll send this out within 24 hours of completion of this live session as well. And also for anonymity purposes, please put brackets anon after your comments if you want it to be anonymized and your name not to be read out. So who is this session for? It's really for you as an individual, whether you're an employee within your organization, whether you're a director, a HR leader, all the way through to a wellbeing expert yourself. It's really important that this session is going to be tailored to you. So any questions that you've got, we've got about 40 already from the onboarding into the session. But if there are any additional ones, please do use the chat feature. So moving on to the panel for today, honestly, this panel is electric. I cannot wait to get going with this live session. We've got Peter Kelly, and Peter has been an absolute, someone that I've really aspired to be in the wellbeing space. He's worked on the ISO 45003, which is a fantastic movement that's happening at the moment, and we'll be able to share more around what that is around developing psychological safety. But Peter has worked with the government, works at the Health and Safety Executive, working around stress risk assessments, for example, and we'll be able to answer any questions on psychological safety and stress at work. We've also got Ryan Hopkins. Ryan's voice is a little bit coarse today because similar to myself, we're shouting at a screen on Sunday evening, but Ryan's got a lot of experience in working at Sainsbury's in wellbeing, and also works as a consultant at Deloitte. And really, Ryan is hoping to bring back the workforce into the office in a sustainable way, and we'll be able to cover anything around those areas. We've also got Zoe, and I've caught up a lot with Zoe recently, and I think she's probably fed up of seeing me as much as anything, but Zoe has so much experience in this space. As you can see, has worked with global organizations from PepsiCo, Vodafone, Bloomberg, and now is working alongside AXA as well as other organizations as a consultant. So any questions on wellbeing, Zoe has seen it all. And last but not least is Laura Dallas. Laura is one of my colleagues and is just one of the smartest people, I must be honest with you, that I have ever worked with. Laura's got an experience and a background in psychology, works with our clients and our members at Champion Health on building sustainable wellbeing strategies. So what a fitting person to be able to join the panel as well. So with no further ado, I'm going to stop sharing my screen so we can see all of the wonderful faces on here. And unfortunately, mine has probably come up in a big way for your screen. But I'm going to start with Peter, if that's okay, and asking Peter a question on psychological safety. The more I read about psychological safety and the studies that are coming out from Google and other places, it seems to be the foundation of a high-performing workforce. Can you talk a little bit more about what psychological safety is to our listeners and how you can build psychologically safe workspaces?
Thanks, Ryan. Or not Ryan, Harry. Thanks for starting with an easy question. I mean, psychological safety has been around, I think, for probably the last 20 years. And really, it's been on the edges of workplace. And we've looked at designing workplaces that encourage people to go home safe. But what we're finding now is psychological health and safety is where we're really at, because in terms of producing safe working environments, you can do that to reduce accidents, but accidents only actually reflect 20% of the problem, whereas we know about 80% of occupational health issues are related to health. Yep. So yeah, what we're looking to do is to get people to create workplaces that incubate health, not actually create ill health. So you want workplaces where people can go and actually go to work and come home healthy, not necessarily always come home thriving and engaged, because work comes along and difficulties come along. But if you go home consistently not feeling 100%, eventually something's going to give way, and it won't be the system. So psychological health and safety is about creating the right environments in which people can work, and it's not just about giving someone a hug, a massage, or fruits and apples and whatever else. It's about looking at the organization as a systemic entity, and thinking, what can we do here to make this place a healthier place to work? The key element, I'll stop quickly. The key element coming out of COVID-19 is how we keep people healthy. Yeah. What we do know is, based on a report by Kelsey in May last year, is there's a 20% increase in sickness absence in frontline workers. If you look at the NHS, 47% of all sickness absence now is down to depression and anxiety. We have a mental health issue. Stephen Taylor, Psychology of Pandemics, Laura White, this is a green book of what actually happens as people go through pandemics. And you could chart this book through the last 12 months. Came out 6 months before COVID hit. So yes, so psychological health and safety is really about creating right workplaces that make you go home and feel well. And here's the massive win-win here. You make people psychologically healthy, they stay physically healthy.
Yeah. Yeah, and the two are heavily interlinked, as we know from all of the research that's been coming out. I guess you mentioned that you spend 1/3 of your life at work, and that's a really important thing to then build the environment around. How do organizations know that they are building a psychologically safe workplace? How do they measure it? And how can you look in the mirror as a senior executive and say, we've got a psychologically safe workplace?
Another easy question. Thank you, Harry. And basically, I mean, I would always start with the measures that you've got. Your sickness absence is a measure of where you're going wrong, not where you're going right. So what you need to be looking at is taking measures across the organisations in very different ways. Do a staff survey. It'll tell you what people like. Actually do a way of measuring people's performance through your line management systems. Then you get an entirely different perspective. And I think what we need to do is look at multiple vectors of trying to get the idea of what people's well-being is and what it looks like. People want to talk to people. Managers need to be able to engage them to get a measure of where they're at. So I think the success is not necessarily the absence of mental ill health. It's actually, success may be that we're on that journey and accepting that some people will experience mental health because it's part of life. You know, I often say when you have a mental health issue related to, say, depression or anxiety, it's a very normal reaction to a very abnormal situation.
Yeah.
And if we normalize it, then that's so measuring, use your existing data that you've got, sickness, absence, exit and leaving, staff surveys, but then look at the really nice stuff, which obviously you expect me as a psychologist, is that one-to-one contact with people, creating a culture where you open and engage with people, and then you begin to get a measure of what's going on in your organization. I know when the Thriving at Work report, which was Paul Farmer and Dennis Stevenson, set out having a mental well-being plan in place. That's one start, because that gives you the systems to measure yourself.
Yeah,
I'm sure Zoe will have loads of illustrations of that, I guess.
Yeah, and we can send that through following this live session. And Ryan, Peter mentioned one-to-one connection being really important at the moment. And one of the things that we were discussing before this event was that we've never been more connected as a society with social media and all of the things that we've got, Microsoft Teams and so on, Slack. But actually, there's more social isolation at the moment in society. How are you planning on getting people back to the office at the moment? I think that's a really topical subject that we need to focus on, and for that meaningful connection to happen.
Yeah, you're flying out with these easy questions to start. Again, you have to forgive my voice. So there was a lot of so-called singing on Sunday to no effect, but you'd have to bear with me. I apologise. So we're not just saying we don't want people to just go straight back, just send everyone straight back in, because we know there's been so many positives from, it's been a really tough year, but there's been a lot of positives working from home. We know we can get into our focus work, the admin work. I can click do not disturb and I don't have to hear from you, Harry. Even if you want to get hold of me, I can ignore you and get my work done. So we know we can get into the zone and get it done. But that works for individual work answering the same problems. To come up with creative solutions to some large problems, you need to be in a room together. And that's why I'm asking people to come back into the office for coaching, collaboration and community. Then we're going to have to increase the connection, the communication as we go back. 'Cause it's going to be a bloody scary time for a few months, because we got quite used to working from home, right? Yeah. This is my little bubble. I don't leave this bubble. Now I go to the gym. It used to be doing pull-ups in the park, but it's not a large bubble. Wandsworth is where I exist. So venturing out to go into the office in Paddington, that felt huge. So I'm just asking people to communicate their journey back, share their stories. And then when we go back in for coaching, collaboration, and community, we'll have a better sense of connection. And I think that's something that's missing. And so a lot of people are really, like we said, really, really quite got used to their bubbles now. But I'm asking people to think not simply what it means to them to go back in, but what it means to other colleagues. So I've been lucky enough to be in the workforce for, 10, 15 years. And I've learned from people being in the office, but there's new joiners, new people that haven't had the chance to rub shoulders and get that sense of connection. So we're asking people to come back in. It's called 2+, our strategy. So it's 2 days at home, 2 days in the office, and 1 flex day.
Okay.
And that's guidance. So obviously each team, it might be different. So for a sales team, you might be out going to visit people a bit more. It might be 4 and 1, but that's our guidance at the moment. And we think this will enable people to get the connection. And that comes from the sessions in the office, like the bumping into people at the coffee machine. I've been at Finastra 2.5 months. And I've been in the office 2 days a week at least, because if I don't do it, no one's going to do it. So I'm in and I'm like grabbing people by the coffee machine. I'm like, hey, where's this at? Like, where's this stuff? And for me, it's been like invaluable. So I think it's about having that balance of both. We can do it from home, but like Peter said, we've really got to make an effort to create a psychologically safe place and put in one-to-ones. We're also measuring how many one-to-ones happen via Microsoft using their analytics. And then we're leaning into the functions where the one-to-ones are not happening. So but as well, we're saying, hey, make sure you do this. It's a bit difficult at the moment, but try and put in this works. It's not simply for you or your metrics. Think about how these people coming up would feel. Yeah. Because the managers obviously learned when they were in the office. We're trying to replicate that for other people.
And that's a massive challenge at the moment, that, as you say, there are a new generation of workers coming through, and some of them don't know what's expected of them. They've not looked around the office and seen people leaving at 5:30, so they think they may need to work till 9, 10 o'clock sometimes. And I've seen that with people. We're
measuring on outputs, not inputs. We're getting that way as well. We're building that in. Don't worry about that.
And that's a huge factor as well. And especially when we're not a manufacturing organisation, for example, measuring on that output is crucial at all stages. Zoe, in terms of just touching upon a few of the elements that we've discussed already, so around building a wellbeing strategy, and I'm not going to ask any easy questions, as you can probably tell today. I really want to get into the crux of how to build that sustainable strategy. How do you go about building a strategy? Do you look at the short term? Because if you built a long-term strategy 3 years ago, it's likely that would have been derailed. Or should you focus on a longer-term strategy? Now, hopefully we're moving into, and fingers crossed, a post-COVID world in the not too distant future. So I guess the question there is, what sort of time frame do you look at when building a successful strategy?
I think both. So you need short term and you need a long term. And obviously the short term needs to be able to be adapted when something like a pandemic comes along. But it is important to do both. So any strategy is going to be based on what your outcome is. We were talking yesterday afternoon. I mean, people, I think, always like to use the word strategy nowadays, but basically it's just a plan. And we all need to be planful. We like planning. We like to look at what our outcomes need to be. And I think if we just simplify for everybody on the call, when you get asked to write this strategy, people just get too complicated. I have been asked to write strategies that are pages and pages and pages long. And I could spend all my time writing the strategy and actually never doing any of the doing.
Yeah.
So it just needs to be a simple plan where people know what they want to achieve, their time frame in how long they have to achieve it, what resources they have available to them, any new innovations that can come along. And then the most important thing, I mean, Ryan touched on them, the communication and the community and the collaboration. And it's finding those key people in your organization that are going to be able to help you do that.
Yeah.
Now, every time I've ever been on a strategy, how to build it, how to be successful, we've always talked about we need buy-in from the top. And without buy-in from the top, it's really difficult, but not impossible.
Yeah.
So that's your first place to start. If you can find a leader, whichever leader it be, and given what has happened in the last 20 years in wellbeing, for many reasons, whether it's been mental health advocates or physical health advocates, if you can find an advocate at senior level in your organization, you are going to be off to a much better start. You then need to really be very clear. I think you joked before that often, and Ryan, I will be the person that says what doesn't work, you can learn from. And what we all know doesn't work is when we try and put too much into our plan, whether that's our own plan or our work plan. If we put too much in, how can we attend to all of it? So just cutting down, looking at your demographics, your data, as Peter said, is going to be the best thing to guide you. It's great looking nationally and reading information about what is happening at a national or global level. But if you can cut that down to what's happening at your organization and pull it back to your organization, what's important to you as whatever you feel is important for your business, get the buy-in from top down, bottom up, and that's going to be the best way of having a successful wellbeing strategy.
I completely agree with everything you're saying there. And I've even heard top down, bottom up, side to side as well, getting those line managers engaged. And everyone buzzing about well-being. We've seen organizations, haven't we, Laura, where they've suddenly changed their approach. The senior leaders start sharing their stories. That can be such a powerful intervention. And the greatest thing about it, and I might be talking myself out of work here, is it's free as well. And there's a lot that you can do free of charge when it comes to well-being. I can see a couple of hands up, and I don't want your arm to get sore. I've taken that joke from someone else. It's a poor joke. But Peter, have you got anything to add within there?
I mean, so he's bang on the money. Compassionate, authentic leadership is key to positive mental health in workplaces. We know this because we've seen it in some of the major banking sector, where the people like Ian Cheshire from Barclays standing up and talking about their own mental health journey. The Lloyd's gentleman that actually went off with stress, the Danish Prime Minister who was with anxiety and depression, and his entire cabinet went to his summer house and they ran the government from there. You know, these are powerful illustrations of things that happen. And I think that authentic, compassionate leadership, we're all leaders in one respect or another in the workplaces that we are. And so being compassionate and authentic is really important. And wouldn't you believe it? Someone's just knocked on my door.
Well, if you need to go and open it, if you're missing your Amazon parcel,
I'm just going to pop my head out the window. 1 second.
That's all good. That's all good. And Ryan, have you got anything to add on top of that as well?
couldn't agree about not confusing that message more. Also, well-being is the most personal thing that we experience personally, and we don't even talk to our closest friends and family about it. Yet the corporate message is so confused and so long with so many KPIs, it gets lost. So I try and operate like a Pareto Law principle with all of the stuff I do. So like 80-20. So I'll do 80% of it. I'll like spin up the guidance, but then as we give that to the functions and geographies, then to manage, then they can personalize it, because then it feels like we've listened. So we go, we heard you said X. This is what we think at a corporate level, but we're also making sure we build this into what we do at each level. Because I work for Finastra in the UK and London in people and places. It's very, very different from the lending team in India, who are in a very different situation from us right now. So to try and plaster my stuff all around the world would get totally lost. So I would try, and that 80-20 principle with this sort of stuff really helps, I think.
Fantastic, super. And Laura, good morning.
Morning.
I'm sure you've got so much to say.
I have everything. I've been like, oh yeah, I was going to say that. Or I was going to think that. But I just in relation to what Zoe was just saying, I think that top-down, bottom-up, side-to-side approach is so important. As Ryan says, it's that tailoring and being able to increase inclusivity in, the different cultures, the different contexts of different parts of the organisation. But I think for me, I feel like I'm kind of championing the bottom-up, the employee-led part of building a strategy, because I think one of the maybe not biggest mistakes, but one of the pitholes I find organisations fall into is that actually they're not involving their employees in developing these different initiatives. And at the end of the day, this is why we're doing this, to support the workforce. So where I've seen strategy implementation work really well and sustain over that longer period of time is when, yes, you get the buy-in, but also you create the wellbeing champions who are shouting about wellbeing at boots on the ground level, but also they can share what's actually going on and any of the difficulties or any of the ideas, what's working and what isn't. So I think that's such an integral part of the whole process. Along with, kind of the top down, side to side, get everyone involved. Representation across all of the organisation is key.
It needs to be part of the cultural fabric. And that's where the authenticity, Peter, that you mentioned previously is so important. That look, you can do all of these training programs, you can give all of your employees platforms, but if it's not authentic, and if you're then asking them to work 16 hours a day, for example, it actually will probably backfire within there. I guess a question for yourself, Laura, is around listening, first of all, to employees and to what their wants and needs are, and also how do you get the data when it comes to these underpinning these initiatives?
Yeah, there's lots of different ways that obviously you can collect the data. I think Peter touched upon that before in terms of the surveys, looking at other measures such as sickness absence, engagement levels, perhaps. I think the way that we approach it at Champion is being able to understand all areas of health, so not just focusing on one aspect, so through kind of assessment. But I think I've seen that sometimes assessment only goes so far. It only brings that quantitative data, which doesn't necessarily tell us the whole picture. So again, what I've seen work really well is when that data collection exercise is paired with an in-person or on Zoom employee forum, where actually you can hear the thoughts and what employees are feeling at that time. I think another important thing, if we think about the sustainability of a strategy, is that if we only collect data at one point in time, it's not enough. Obviously, it's important for that period of time, and we can create a strategy that's in line with that data. But what's really important is the evaluation, and that actually we're collecting data on a continual basis to really allow that feedback and then that adjustment of the initiatives. And then it turns into something that evolves with changing needs. I think we also touched upon that in terms of the short-term and long-term differences. And, we don't know what's around the corner. Obviously, with the pandemic, it kind of took everyone by surprise, or probably not the author of the book that you mentioned, Peter. But yeah, getting that continual data as well. So not just seeing it as a one-off exercise, but actually a continual exercise that will help to shape the strategy long term.
And I was speaking to someone the other day that's a leader in the space, and they said anyone that thinks they can complete well-being they're just wrong, because things change so frequently. There are always unique challenges. There'll be new people joining the organisation, people leaving, and the organisations that think they put something in place and that's all they need to do are the ones that are going to fall behind quite quickly. So I've got a lot of messages to get through. So we've got hellos from Hertfordshire, North Yorkshire, all the way through to India, Australia. So welcome to the session. We have got some questions as well. Is there a new version of the Thriving at Work report that Peter mentioned? There is a new version that was out in 2020. So again, we'll send the updated version. That was a study that was done alongside Deloitte and Mind, and really goes into the cost of looking at poor mental health, also the interventions and the practices and interventions that you can put into place as well. Lisa mentioned, I love hearing you say that, Zoe, as we refer to the biopsychosocial model as top down, bottom up and outside in, and being able to transfer that over to the wellbeing strategy really helps to get the buy-in. The biopsychosocial model is crucial to look at. It's looking at all factors around wellbeing and the biology of human beings, the psychology, but also the sociology and the community aspects that Ryan and Zoe rightly mentioned. And we've got a question from Charlotte as well of how do you balance the need for people to come back together for their own benefit, for connections and for business needs against employee preferences? We've been hearing that employees are leaving employment because they are being asked to return to the office at least part-time, as they want to work from home 100% of the time. Is it really possible to give every individual what's right for them as an individual whilst also meeting business goals? So I'm going to hand that one over to yourself, Ryan, to begin with.
I thought you were going to.
Yeah, sorry, mate.
I see that one coming. I tried to get out of the way, but I wasn't quick enough. Yeah, it's a hell of a question, isn't it? Like, unfortunately, we did surveys prior to my joining, and 89% of us asked for some form of hybrid working, be that 2 days in the office or 4, with 11% asking for full either way. So we are looking to cater to the majority. We're also thinking, unfortunately, we can't cater for everyone, and there's some people this is not going to work for, and they've tried it. And then they will ultimately give it a go in the office, decide it's not for them, and they prioritise time with their family or otherwise. And then they'll find other employment. Unfortunately, we can't cater for everyone right now. We've gone through 2 extremes of being completely in, not in, and now we're trying to go back to cater to the most. We've also made a decision as a business that we believe that employees or top talent want to meet people in person. And if we go completely remote, we believe that it becomes more of a transactional employee model, where we're paying for services. We might as well offshore everything at that point. We decided that we want people to come in for the connection, for the collaboration, to come up with creative solutions to like the financial industry's largest problems, which is what we're trying to do. So we believe that requires time in person. It's about that balance, and we hope that we're going to give people the flexibility with the 2+ model. It's not prescriptive. And we'll have I'm going to set each manager up to understand, or trying to. We're going to create team charters where we all advocate personal preferences, build it into how we work, the times. We think that this will make most people in the organisation happy. We believe it will attract the talent in the future that we want. Will it capture everyone? Sadly not. But that's a decision that we've made, and we think that we're going to keep most people happy, and it'll be the best way.
Fantastic. And it's such a challenge for many organisations. We've made a decision at Champion that we're always going to work remote. And I've looked at all of the data.
We knew it would happen, didn't we? We knew it would happen.
We're waiting for
it. It always happens. So if you do need to attend to your dog, Zoe, then that's absolutely fine. But no, we've made the decision to work fully remote, and it is. I think we're now at the point where there's been so much anxiety and confusion across organisations of do we, don't we? Actually making a decision and saying this is what we're doing for the next 6 months. We found has actually relayed anxiety and just settled people in terms of okay, that's what I know I'm going to do now for the next 6 months. Peter, I can see you've got your hand up as well to be able to input on what Ryan said.
Yeah, just before Ryan, people need decompression when they're coming in for the first time and the first few times. Don't put a meeting in at 9:45 if they're coming in at 9.
I was like, come in for a half day, come in for an hour, come in for a meeting and go home. Like, take your time. It's going to be bloody scary. It was for me.
Yeah, because of that depression and anxiety. Or not even, people are coming in with heightened emotional expectations. Holy shit! Excuse my language, but that person coughed over me and refused to wear a mask and spent all of that time. And so, sorry for that. That's me being Australian. But I guess the other side to it is that genuineness, isn't it? And that sort of realness. Here's we are not going back to the same offices, the same places. Work will be different for the next 2 years. This pandemic will be here in some form over the next 2 years. The way we work, how we work, and way we work, and the flexibility is all going to become part of a new narrative. Yeah. I'm telling you now, in 2.5 years, I'm going to be saying the same stuff, which is put your people first. And that's how you become successful organizations. Wellbeing works when it's about the organization and the person. People say to me, I wanted you to talk about personal resilience. I went, I won't. I'll talk to you about organizational resilience. I'll talk to you about organizational mindfulness, because the same principles we're asking our people to do should be what we should be applying at an organizational level. So I think that's really, really, we may not have open plan offices in the next 3 to 5 years. That's what the science community is now talking about. So what do? You're going to have to learn to adapt and adapt very well.
I think it's really important. We refer to something called the Wellbeing onion that's been adapted from the social ecological model, whereby you look at the individual level, and that's around self-care. And that's where a lot of organizations are investing their time and their resource into. But actually what the impact is upon individuals is the organizational level. What's the organizational policy around work-related stress, for example? As you say, is the organization practicing what they preach from a senior leadership level? And that's absolutely crucial as well. Zoe, I can see that you've got your hand up as well.
Yeah, first of all, apologising about the dog barking. But then going back, and this may be a little bit controversial, so to pick up everybody's point, I think whilst we all, and of course in my career, I've always said putting the employees first, but the question that came in about who needs to go back to work and how, I think does need to be put back to the organisational business level need. Because we aren't going to be able to please everybody all of the time. So what we need to do is sustain that business. So there is a business for us to have employment, for us to build our strategies. And I keep hearing that we're not thinking about that in the first instance. So when we look at the plan, it's no different to how it has been for the last 20 years about who could or who could not work at home prior to the pandemic, because everybody always had different ideas and we didn't always have good guidelines, and there was always frustrations as why is it all right for Laura to work at home but not Harry? And so I think we must go back to, if we are going to be successful and build the cultures, we need to be believable and authentic. And if you need to be in the office for your job, for whatever reasons we're all rightly saying, whether it's for the collaboration, whether it's the learning, the education, the demonstration of mentoring, that's important. But the most important common fact is that what is the business need is why we're there in that employment. So sadly, that will mean that some people will change their careers for a different reason to why they thought, because they don't feel comfortable. And we're not, as Ryan rightly said, be able to do that all of the time. But please can, when we're talking to our organisations, really put that into practice, because there are differences of whether people want to work at home and they don't want to work at home, but there are organisations where people are needed and have throughout the pandemic had to go to work, whether they liked it or not, because that was their means of employment. And we must remember that at all times when we're planning our strategies and what we're suggesting to our workforce.
And Nick makes a really good point that many people are actually not office-based, and there's a huge population of retail staff, fleet-based workforces as well. And actually, again, customizing your wellbeing strategy to those organizations is just as important. And I'll target this towards you, Laura, within this question. How do you build a wellbeing strategy outside of an office-based environment, which may have more access to technology, for example? How do you make an inclusive wellbeing strategy to people that are away from computers and technology?
Yeah, it's a very good question, and I'll try answer it. There was just one thing just before I do answer that question, that following from Zoe, and I wonder whether for those when we're putting those business needs first, that actually it's then the transparency that's key with employees, because actually it's that uncertainty that creates a lot of anxiety. So if employees are left in the dark in terms of what the expectations, what the policy is around that, then that's going to, make them feel worse as a result. So really communicating that message clearly is key in those kind of situations that you mentioned, Zoe. In terms of strategies outside the office, there are a few clients that I've worked with who are, say, based in construction. And it was a very interesting client to work with, because they did have some office-based workers, but then obviously they had the construction workers on the ground. So a real individualised approach to the different types of workers was needed. So, for example, what was really useful is actually understanding where the construction workers in particular were coming from in terms of their experience of well-being. So is well-being on their radar? If we start talking about well-being workshops or mindfulness, is that really going to sit? It comes back to the language. Is the language that we're using appropriate, and does that resonate with them? And as a construction firm that is mostly male, we felt that actually that message wasn't going to float so well. So it was about thinking, well, what's worked in the past? And what's worked in the past is actually getting the guys together and talking about the practical difficulties. So, what are they facing day to day that is actually stopping them from doing their job? And actually, in approaching it that way, we could open up the conversation very gently, and actually then 6 months down the line they were able to introduce wellbeing initiatives into the construction end, or the construction facing section of the organization. So I think kind of bringing it out, zooming out a little bit and thinking about inclusivity, it's really personalization and actually looking at what's worked previously and implementing that going forward in my experience. I don't know if anyone else has anything to add around that.
Meeting people where they are. That's exactly what you're saying.
Exactly.
Know your audience, and that comes from having the good quantitative data to understand what you need to look into, and the qualitative data you said we did. So it's a mix of those two data sets, along with understanding your audience, and then you're away, because too often you see like this generic approach or generic strategy for a bunch of people. You say mindfulness to probably 70% of the population. They're like, nah, no thanks.
God,
if you said, how about let's take a second, have a cup of tea, sitting by your window, and just not pay attention to anything, a mindful cup of tea, that'll land. So you're so right.
Yeah,
I did exactly that with a foundry sector. I went and I thought they wanted to do mental health, but I had to understand the foundry sector. So I went and did 7 visits across the foundry sector, and there's some big lads in there. So I had to target my mental health sort of initiatives around exactly understanding them. And we ran a campaign, and the original about was about your mental health can't be asked, which is what they wanted, but I couldn't get that through HSC. And so actually it was I can't be bothered. But it came from them. That was a really important thing. So when I went in there, I had to apply my understanding of mental health and wellbeing in a way that actually engaged them, which was probably very different from what you do in an office. And that applicability and that genuine, I think it's genuineness, isn't it, Ryan? It's being genuine. Yeah. People see genuine, and that's really important. And that can that was great. And I walked out of doing a training session. As I walked out, one of the lads came up to the supervisors and said, Jim, can I have a word with you? We've just been on that course with that fellow there. I think Paul needs some help. And it was that instant thing, because they felt engaged. They could understand. It's really important.
Yeah.
And we're going to come on to engagement shortly, because that's such a big topic. But we've got a really important question from Gabriella that I'm going to forward on to yourself, Zoe, from all the global organisations that you've worked with. And Gabriella has asked, what would you say is the most important factor when shaping a strategy for a large global organisation?
It's pretty much been summed up by what the other three have just been saying. It is the personalization of knowing the workforce. I think it is too difficult. Like I said earlier, when you're trying to make one plan, you still need to be able to break it down and have small chunks, because otherwise it won't work. So I think for a global organization, you can have a theme, but then you need to really personalize it for each of the individual area that you're working with. So that will be very different in India to Australia to Japan, just as it would be very different if you have factory workers to office-based workers to retail workers. So it's always just that, making it specific to the audience that you're dealing with, getting their buy-in, because that's all that's going to matter. And often I used to always find that if you think about the individual in each area, what you're trying to achieve, talk to them, have some insight into it, and then keep that front of mind, you will put in a really successful plan that people, as you say, believe, because it's authentic, and they will buy into it. And then to find the health supporters around you to support you while you're putting that into practice. So I don't think I'm saying anything different. It's always just still being clear from your data to your plan to authentic, purposeful, personalized programs.
Fantastic. And I guess there's a big thing around the sustainability as well of these initiatives. And the title of this live panel event was how to build a sustainable wellbeing strategy. What you can often see, and as we probably will have all experienced, is an initial spike in engagement, but then how do we continue engagement over a long period of time? I don't know who would like to answer that one, Peter. Do you want to go forwards around sustainability of wellbeing initiatives and programs?
Yeah, and I'll do that before my government computers love to do restarts. If I drop out again, you'll understand why. Sustainability has to be aligned with your own organisation's, key performance indicators. I would put mental health as a key performance indicator in an organisation. I think too often we concentrate on lagging effects, not the leading the stuff which needs to be there. Sustain, it means it's got to be not necessarily reinvented, but re-engaged.
Yeah.
If you get feedback that something isn't working, tweak it. Don't scrap it. If you've got one part of the organisation that's saying we're not getting it, another isn't, and adapt it. I was really interestingly, Eon did a head shed where they put it in the head office and they just literally, it was on the back of a trailer. You got the steps, and it was all about mental health. They didn't put anything about what it was about. It was just a garden shed in the middle of the head office. And it went down a tree because people went in, and then suddenly the queue of people wanted to go in. But then the lads who were out on the field said, well, that's not fair because you're getting that, but we're not getting. So what did they do? They put it on a low loader. They took it out to a field. They dropped it in the field and they left it there. They did exactly the same. And I think it's that innovation that's really important, and adapting that is, and with the sustainability element, align it with the objectives of your organisation, what you want to achieve. It's really good business sense to keep people mentally healthy because they function better and they work better, and they tend to create productive organisations. The reason there are the top 500 companies in the Times to work with, the top 100 have one key characteristic in all of them: well-being. They look after their people, and they get looked after.
And it was really interesting. We did some research recently on where the investment is actually made. Is it technology and data, or is it the people? And I'm sure we find every organisation will say that they invest in their people. Their people are their most important asset. But then when we actually look at how much is invested in the technology, it may be argued otherwise, which is a really interesting thing that we found. I guess there's a theme of senior exec buy-in here, and we had multiple questions around that. Zoe, how do you get senior executive buy-in? And I'm sure you've seen a lot over the last 10, 15 years around mental health and the changes that organisations are making, and the changes to approaches as much as anything in individuals. How can you get that executive buy-in when there is some pushback potentially?
Yeah, I think it's just by having one small success. So you do have to listen. You do have to know something that's going to resonate with someone. So if you really are buffering up against it, you've got the job. So they've actually put somebody in to do wellbeing in the organisation. You've clearly got some buying at some point. You've got to find who was that link, who was that sponsor. And then rightly or wrongly, find out what's going to make them find it easier to sell it to the rest of their colleagues. So if it is something around a physical activity or something about healthy eating, in all of the conversations, we are talking a lot about mental health, and that's really important. But actually, when I started doing wellbeing, mental health was not mentioned in the workplace. And while we're picking up the pieces about that now, and that might not be right, remember that there are two sides to this. And while we all wanted mental health to take a great step forward, we don't want to forget the physical health, because nice guidelines are the best thing for mental health is physical activity in the first instance. So there's a great piece of putting the two together. So to answer your question, Harry, you've got to have a small success and build on it. That works for people personally and it works for organizations. So if you can find a chink by looking at the data, as Peter says, the sickness absence data, a great place to often look is exit data. HR departments do why people are leaving the business. If you can't get it from them, look at Glassdoor. We've all seen a couple of organizations in the last few weeks in the public space be hauled over the ropes about something they've done. You don't want your company in that place. So sometimes you have to be devious. Yes, you're smiling and pink and fluffy on the outside, but you need to really think what's going to make a difference to the people that you've taken that job for. So sometimes really get under the skin, what's actually not working in the organization, find a champion. If it's not a very senior level, go to the next level down, get a groundswell of something that's working, and it will filter back up.
Peter had his hand up, but I think the government restart on his computer. He may have just put out. I was going to pass over to Peter.
He might have just been letting you know he's about to drop off. He goes, he's about to fall.
Yeah,
He's
quite
back.
possibly.
There you go. Hi, Peter. I was just about to pass over to you. I'm
back. Just very quickly, so the Foresight report by Kerry Cooper about 12 years ago, mental capital and wellbeing, exactly that point. Also, PH22, which is nice guidance on mental wellbeing, says the same. Invest in people's physical and mental health, and then you get a cross correlation between the two, and it's really important. I guess what we've done for too long is thought if we give someone a gym membership, but we still put them back into really rubbish organisations, somehow that's going to actually help their well-being. And what we're learning is it has to be a gym membership plus something else, and which is normally make the job and the person align together in a way that actually makes them work effectively. So. But yeah, so there are good reports out exactly what.
And really interesting on that note, Peter, you're right. The one thing that never comes up on any wellbeing discussion anymore is smoking. And yet when we were all put into place in the first instance, it was starting a no smoking policy, and really encouraging. There's one single health app that still will kill you, regardless of any data that you try and go. So it's really interesting that one of the things that when I go into companies and they're struggling to know where to start with the basics, have to look at what will really make a big difference to your organization, and whether it be healthy eating, hydration, as Peter says, there's no point having a gym. I've worked in organizations where they put in the most fantastic gyms, but people aren't allowed away from the desk to go and use the gym. Not much point having a gym.
That's it. That's it. It's creating space for me is number one. Because if your glass is full with work, how am I going to pour something else in? My glass is full. And therefore, no matter what time the gym's open, if I don't have time, I can't go. If I'm too stressed, I can't go. So it's about taking something out. And we're doing that by empowerment. I want to enable every single person in the business to decide how they want to work, when they want to work, make sure it's geographically agnostic. They've got all the tools enabled to do it. We're rolling out flexible vacation for everyone in the world, no limits. We employ smart people to do a job, and we trust them to do it how they want to do it. And I think then we can make the most of these other things. So it's creating space via empowering people to prioritize themselves. because we know an apple's better than a packet of crisps. We know a glass of water's better than a fat Coke. We know go for a walk's better than sitting in your chair all day. So we create that space, then we can use those things.
Absolutely.
And then you can have a fat Coke.
Yeah, I try and stay away from it unless I've had a few like beers and now a fat Coke next day, but normally just water.
And one of the big things I wanted to touch upon as well was, does a health and wellbeing strategy sit alone? And this might be a slightly leading question, or does it tie into, as you say, Peter, before, the business objectives, the KPIs at board level? We need data to be able to do that. Does it tie into learning and development? Does it tie into diversity and inclusion? And that last topic, diversity and inclusion, the last 48 hours, I think, I'm just sharing my personal experience. I've really struggled the last 48 hours with what's gone on in the UK. And especially the racial abuse towards the three young lads that missed the penalty. How can we make sure that wellbeing ties into diversity and inclusion and those other areas? I'm going to leave that open. I don't want to put one person on the spot within there, but I'd be really interested in hearing your thoughts on that.
I'm happy to kick off. I think you make a really good point. Wellbeing has to be across the whole of the organisation. And when I started doing this a long time ago, 20 years ago, we didn't even have PowerPoints. And I made an overhead slide with a balloon, and in the basket was the wellbeing, and the balloon needed to raise. And each of my ropes attaching my balloon to my basket were health and safety, communication, all the business strategies, all of the different pieces. And over the years, that's always, when I go in, people say, we've chunked it up like this, we've chunked it up like that, we think it sits here. I've worked for big organizations. I've been sat in HR, in occupational health and health and safety. It doesn't matter. Probably the best organization I ever worked for was when I sat in the comms team, because basically that's what we need to do, is communicate a joined up approach. So for me, I couldn't agree more. It has to be across the whole piece. It's difficult, but it does have to be across the whole piece.
And Peter, Laura?
Sorry, I was just going to add that if it's integrated into the different areas of the business, whether that is with pairing up with a diversity and inclusion lead, then it's going to really help to create that wider culture change. We are not an island as wellbeing. It sits within everything, as I'm sure everyone's kind of gathered from this conversation. So to try and approach it alone just doesn't make any sense.
Fantastic. And Peter, did you have anything to add on that topic?
I just said I've just delayed it for another 5 minutes. Let's look. Health and wellbeing isn't a nice to or an add-on. It's a necessity. It's a necessity in a successful business, and it is the difference between a success and failure. And I can say that categorically because the successful companies that are out there are ones that look after their people. Yeah. And wellbeing, as we know, and so we'll confirm, is multiplicity. Okay? Yeah. There's physical well-being, there's mental well-being, there's financial well-being, there's environmental well-being. But at the heart of it is the person and looking after the person so that the person looks after your business. And I think integrated, I'm so tired of people. It sits with HR, it sits with health and safety, it sits everywhere, and you have to put it everywhere if you want to be successful in this arena. So yeah, don't have a bun fight and think it's HR or it's whatever. It goes right across. Don't have health and wellbeing meetings at lunchtime. Don't have it at the end of the day. Make it.
Lunch and learns are dead. I hope to never see one ever again. It's lunch and learn separately.
Yeah, 10 or 11 o'clock. Make it a priority because people will see it as a priority.
Yeah.
So
I've got
unless you're going to provide the breakfast or the lunch, then I might come. If I'm sitting at home eating my own lunch, no.
I might drop out at it in about 3 minutes, but I'll
yeah. Well, I'm about to recap, but I was about to say lunch and learn. It just goes to show where wellbeing sits on the organisational agenda within there. So. Just to recap from everyone, thank you so much for your time today. What would be the lasting comment for the listeners to go away with? Ryan, are you happy to kick off within here?
Yeah, of course. Apart from lunch and learns are dead. I just think, I totally agree with everyone saying it sits across the business. It's about empowerment for me. I just want to give everyone that tiny bit of space, and that comes from digital balance, having those conversations. So create some space, and then people can use all the things that exist instead of pushing stuff down. People are full, create some space, then we can look after ourselves.
Brilliant. Fantastic. Peter, just before your computer restarts.
Just actually take this thing for real and be the difference with you, the people that you work in. Like, stop making excuses. Stop saying we can't do it. It's too hard. I give you too hard. The next 10 years is going to be too hard. We are looking at a global impact on people's mental health. And we have a chance now, and we've got all the tools to make well-being central to the recovery of that. Or we can just go back to the old way of saying, you're ill, and we'll only deal when you've got a problem. Better to improve the workplace now, because we have kids that are coming in to the workforce in 5 years that have had a year and a half out of a pivotal time of their life, and they're going to need support. They're going to need to be looked after.
Thank you, Peter. Zoe?
Yeah, building on what Peter said, I think it is. We need to look for the health creators in our organisation. We've got to make it proactive again, instead of just reactive. We do need to deal with the problems. We all used to talk about the iceberg, which was above and which was below, and how to make that work and how to get the spend in businesses in the right place. I think you're completely right, Peter. I think the pandemic, however long we label it for, is going to be a much shorter period than the recovery period. I think we need to go in positive. I think that we have the opportunity to do that. There are lots of fantastic new solutions at our fingertips, which we didn't have before, that can have a far reach to all of our friends and colleagues. And as I say, look for the health creators. We need to build these communities. The communities need to join. And that's the only way we're going to actually see some improvement across the businesses with health and well-being.
Fantastic. Thank you, Zoe. And Laura?
Yeah, just to wrap up, I think for me, the most important thing when we're thinking about creating a sustainable and long-lasting strategy, it's about keeping the conversation going. I think that kind of echoes everything that we've been saying. It's about making well-being visible, engaging employees, not just senior leadership, everybody, and really bringing it back to what Zoe was saying at the very beginning. A strategy is quite a scary word, and I think it feels quite overwhelming. But at the end of the day, it's just a plan, and it's a plan that you can set out sometimes quite easily. And yeah, just for people who are listening, just don't be scared of it, because it is so integral, and will really help to support your employees.
Absolutely. Ryan, one more thing.
I told you made me go first. I was always going to come back and do this. So you'll know next time to let me go last. First, I just want to say thank you so much for putting on this session. And I think that this is what's key. So this stuff isn't zero sum. Like, if I'm doing something well here, I want Zoe, Laura to do it well here. So I think these cross-company, cross-industry sessions, conversations, we can all help one another to elevate everyone, because ultimately, I might not be at Financial in a few years, and I want to go into a place that's got a great well-being strategy. So I think we can all help elevate together as well, everyone across industry. So thank you very much, Harry, for putting this on. I just want to say it's been fantastic.
Not at all.
I've learnt lots.
Yeah,
me too.
I've got loads of notes. What a panel we've had. The lasting comment that I'd like to make is what a legacy you can have when you retire by supporting your employees' well-being and supporting those around you. I've lost people due to poor well-being. We've also impacted a huge amount of people. And whether it's one person, whether it's a team of people, what a fantastic thing you can achieve within your career within here. Thank you so much to the panel. I could keep going for hours and hours on this. I feel blessed that you've been able to join us today. There will be a recording that we'll send through, and we're also developing a guide off the back of this to be able to support you in sustaining engagement with or building your wellbeing strategy. Thank you so much to the panel today. I'd love to hear all of your feedback as well, and what the next panel event will be on. Please let us know. So enjoy the rest of your day, enjoy your lunch, and I'm sure we will speak soon.